So just like tissue factor being expressed widely in cervical cancer, TROP2 is also widely expressed. So we see it, probably in 90% of patients with 60+% having really high expression. So this also makes TROP2 a very attractive target for cervical cancer patients. And the rationale for the study is based on that, but also there's some phase 2 data that shows response rates as high as 50% in second line, third line patients. And so we're seeing a really provocative or compelling response rate in these patients. So the study design is looking at patients after exposure to immunotherapy, and they could have received it with radiation or with chemotherapy, and they must have received a platinum-based chemotherapy regimen. When they have recurrent disease at this time, they may be eligible for the study. The study randomizes patients to either the Sacituzumab tirumotecan, to either MD choice chemotherapy. And there are several options that the physician can use, and that does include tisotumab vedotin as a control arm option. It is randomized 1-to-1, and we are looking at just under 700 patients for this trial. And I'm excited to report that we're almost, I believe, a third of the way enrolled. So we're recruiting really quickly, which just shows you how needed this trial is. And the study so it's very early, so we don't have any results, of course, but it's open globally. And so we have countries across the globe who are being able to provide this study to their patients.